Christina Bausch. I'm a physical therapist and pelvic floor specialist here at Rebound Physical Therapy. We're an outpatient clinic and we're located in Topeka, Kansas. And today I want to talk to you a little bit about pelvic floor dysfunction and how it can create pain for women with intercourse or with pelvic exams. So to begin with, I'm just going to show you a little bit of anatomy. So if we were to look at the pelvis here, so in the front we've got the pubic bone, in the back we've got the tailbone coming down, and then if we're to look at it from the underside, all this pink area here is what we call your pelvic floor muscles. So there's multiple layers of those muscles. There's some that are more superficial, and then there's some that are deeper. And for many women, there may be some dysfunction going on in these muscles, which is creating some pain anytime that there's any penetration or any pressure against those muscles, or they can cause pain even just throughout the day with normal activities. So to begin with, I just want to talk about what that normal function of the muscles is. So if we think about what a muscle should be like when it's at rest. So if we think about like my arm muscle hanging here, when it's relaxed, those muscles should be fairly relaxed. If we were to measure it, there's a little bit of muscle activity going on, but not very much. When you want to move around, when you want to contract those muscles, they should squeeze in, lift up, provide some support, but then they should be able to go back to that relaxed state easily. When you do want to empty your bladder or have a bowel movement, we want those muscles to be able to go from that relaxed state to actually shut off even more and elongate, let everything pass through. So for some women, those muscles may not be at that relaxed state at rest like they should be. So instead of them being relaxed here, they may actually be holding a little bit of tension in them all the time. I find it's common for women, especially maybe some who have a history of doing dance or just kind of that awareness of, I want to keep my posture, I want to keep my abdominals drawn in. That kind of feeds into not only holding some tension in those abdominal muscles, but it causes some tension in those pelvic floor muscles too. So sometimes that can actually lead to those muscles kind of staying in that tense state, and then they're not able to relax the way that they need to when we want them to. So one source of pain can be that just like, any muscle, like your muscle in your shoulder or your upper trap area here, sometimes you may find tender points or knots in those muscles that are tender to press on. So just like that, these muscles within the pelvis can form trigger points or tension areas that are then painful when the muscle is stretched or pressure is applied with any type of penetration. So one way that we can work on that is actually to, just like if you had a knot up in your shoulder muscle, you can apply some pressure to that and get that muscle to relax. So the same thing applies to these muscles. We can work on those areas, get those tension points out of those muscles, and then that allows the muscle to stretch and relax the way that it should to allow comfortable penetration. Sometimes there's more to it than just the tension or the knots in those muscles. Sometimes there's a history of knowing that pain is going to be involved. So not only do we need to normalize that tissue, we also need to kind of retrain those muscles of how to be at that relaxed state. So especially if you're anticipating pain, those muscles may be a little bit guarded. So we can work on strategies to help to reset that, bring that back down to that relaxed state so that they're able to relax and allow you to have intercourse without pain or pelvic exam without pain. Another factor that can play into it too is sometimes during different times in our lives, there may be some hormonal changes or some dryness that can affect the sensitivity of the tissues as well. And there's strategies that we can work on in physical therapy that's actually going to increase the blood flow to that area, which is actually going to be that source of adding moisture to those tissues without needing to use hormones. So that is another factor that is common for women that we can work on as well. So if you're experiencing any pain, it may be lower abdominal pain, it may be vaginal pain, it may be low back pain. All of those areas could actually be caused from a pelvic floor dysfunction, and that is something that physical therapy is really good at working on and improving those symptoms. So please reach out to us so we can talk about your specific scenario and put together a plan that works for you.